Hello, my name is Marianna Kassai and I'm a child and family therapist working at a private therapy clinic in London. One of the type of therapies I do is filial therapy. I'm going to explain to you what filial therapy is, who is it for, to see whether your family might benefit from this type of therapy. Filial therapy is a type of family intervention which is based on the partnership between the parents and the therapist. The therapist trusts the parents' capabilities to use and implement therapeutic skills and therefore become the main agents of change of the therapy process for their children. Parents are in a closest position for their children and therefore the best observers of their behavior. Parents are also the most important people in the child's life, and filial therapy aims to strengthen this important relationship. Further aims for a filial therapy are to decrease the levels of stress, anxieties and frustrations within the family, help the family members to improve their communication skills, understand each other's emotions better, help them to express themselves more safely, increase the levels of trust among family members, help to deal with children's inability to concentrate or anger or aggression. Filial therapy is beneficial for families who experience significant events such as relocating to another country, moving house, or families who experience difficult life events such as hospitalization or chronic medical illness of a family member, families who experience traumatic events, loss or separation. Upon an assessment, we would hold a meeting where we would discuss your concerns, the family background and the situation your family is experiencing, and also as much relevant information as possible in order for me to make sure that I understand your situation fully. Besides the meeting, I would also visit your family in your home environment and carry out an observation by observing you as a family during the playtime, where I would try to see the interactions among your family members. Upon a meeting, an important relationship starts to develop, which is our therapeutic relationship, where we develop a collaborative alliance where you as parents become my partners at the same time. Filial therapy consists of several stages. Firstly, I would demonstrate a play session as a mock session where you as observers would have an insight how to structure a therapy session with your child, and upon a meeting afterwards I will explain to you which therapeutic skills I was using, and in the next phase I would train you directly how to use specific therapeutic skills. These skills are, for example, empathic listening, which means how to listen to the child so the child feels that is being heard and accepted. Secondly, enhancing the child's imaginary play which means that you let the child to make their own choices and therefore learn to take responsibility for their own choices. Importantly, I will also train you an important skill, which is how to structure the therapy sessions, which are also called the special play time. Another important skill is limit setting, which is based on a rule that nobody gets hurt and nothing gets broken. You will have the opportunity to get acknowledged with these skills and implement them under my direct observation in the play therapy room. After each session, we will have a discussion about your reflections, your overall feelings, what do you think, how did the therapy session go, we discuss any questions you might have. And once you are confident enough to implement these skills, the therapy sessions can take place in your home environment, and I do not necessarily have to observe these. However, weekly or bi-weekly meetings would be held in order to discuss your observations regarding any changes of behaviors or whether the aims we were setting initially are being met. The last stage is the ending stage, which means that you detect changes in behavior and the aims set initially for a filial therapy are being met, and you feel more confident as a parent and also as your child's therapist. If this sounds like the right type of intervention for your family, please get in touch with Private Therapy Clinic.